Hi, my name is Benda Kithaka. I'm a health advocate with Kilele Health Association. We are an association that's working to empower our members to live beyond limits and to ensure that we are handling mental, physical, spiritual, and financial well-being of people living with chronic conditions. So I started in health advocacy over 10 years ago. And when I started, it was from a personal story. My sister was told she had cancer. It wasn't cancer, it was pre-cancer of the cervix. What was interesting was I was in corporate Kenya. I didn't know anything about cancer being preventable. I did not even go for my regular screenings. And so for me, it was an aha moment when I had that cancer is preventable. She was treated, she recovered. 1 year later, she was having a baby. And what we know in society is that cancer is a death sentence. So when this happened for me, from a communications perspective, I asked myself, what can we do to change the perception and to get people to embrace prevention as opposed to waiting until cure? And so we started an organization, at that time, Women for Cancer. And I worked in Women for Cancer for 9 years as a co-founder. But last year, but 2019, a series of activities happened. A year before, in 2018, I lost my grandfather to cancer. But it was after he was treated, he had recovered, and into his survivorship, the quality of life was really bad. He lost his memory from some of the interventions that he received. 2019, a dear friend of mine who was my sister in the trenches for cervical cancer advocacy died from a cervical cancer recurrence. And that hit me really hard because the thought that cancer is treatable, preventable, and then it has recurred and she died of it was really, really a tough point for me. When she died, I went into 3 months depression and I realized I needed to handle myself and the work that I was doing differently. And so I took a personal challenge to go up Mount Kenya to find God and to find myself in my advocacy journey. I kind of wanted to find out exactly why am I in this space for health advocacy. And I was feeling like all of a sudden my work didn't matter anymore if I could lose someone to survivorship. But I knew also if you want to go far, you go with people. If you want to go fast, you go alone. I didn't want to do the mountain alone because I was scared, but I knew I wanted to do it right and to do it scared. So I called upon my friends in advocacy in the cancer space. Some of them, women who have gone through the cancer journey. Some of them, women who have cared for someone who has gone through a cancer journey. And all of them had one thing in common. They were at that space where they were asking, what next after all that I've gone through? Why should I have gone through this journey? And so we embarked on the journey in 2019. We had not anticipated COVID-19. And in COVID-19, just when we had put our place and our plans in place to climb Mount Kenya, just when we had thought we could start practicing, COVID happened. And that was yet another moment for me. So to start the initiative, Kilele Health Challenge, was to overcome self-limiting beliefs that you can't do that which you have set out to do because COVID is here. It was also to overcome community-based beliefs and stigma that once somebody has gone through a cancer journey, they are on a death sentence. They are not going to survive. They cannot live quality life. That to overcome community stigma as well, where everybody looks at cancer as a death sentence, where everybody looks at cancer once you're diagnosed, you're not considered to be living anymore. We wanted to prove that you can live beyond the limits, you can live beyond the challenges, you can live beyond personal perception as well as community perception. And that's why Kilele Challenge was founded, to inspire others to live life beyond limits and to inspire others to realize that health is in our hands, we can change it. There are a number of achievements that we've done in the last 1 year alone. I can tell you from when I started in advocacy, running with an organization that was reaching communities before COVID, educating them on cancer prevention, educating them on benefits of early detection, on benefits of timely treatment, which means if you're discovered early, we can treat it better, you can recover fully. For impact for 9 years, I can say we've reached over what? I would put it at the whole population, really, because we were doing a lot of media advocacy. If you search for me online, you'll be able to see a lot of media appearances, international appearances advocating for women with cervical cancer. Coming back to the country, being on panels where we're discussing policy, where we're discussing interventions, where we are formulating strategies at the Ministry of Health, sitting on technical working groups. That for me was impact in prevention. However, with Kilele, that's why I said there is so much to pick from in terms of impact. With Kilele, my biggest achievement was to get people who did not have the belief that they could actually climb Mount Kenya. Getting them to practice, getting all of us to believe in ourselves hard enough, even during COVID, to get up every morning and exercise, to get up every morning to go and get ready to climb Mount Kenya. It took us 9 months to prepare. And it took a lot of work because some of it was you go to corporates for sponsorships and they can't give sponsorships, or corporate sponsorships were stopped. So we had to finance it from our own pockets. And the thing about the achievement in climbing Mount Kenya is the type of internal mountains that we climbed. I can speak for myself to say that when I started, it was an initiative to inspire others, but it also inspired me to start being deliberate about my life. What am I doing every single day? What am I targeting every single day? Am I doing that which will lead me to the ultimate goal, which was to get up the mountain? On the community level, inspiring others to own their health, to know that if we all take up the COVID-19 measures as the government has spoken, if we wash our hands, if we sanitize, if we keep social distance, we can hike together and go up that mountain. To be able to inspire the women who were on the program, some of them coming from slum areas, was a big challenge for me, that we got them to believe enough in themselves to be able to get up and say, I've never been out of Nairobi, never been to a gym, but I believe that I'll be fit enough to climb up a mountain. And on 20th to 24th of September last year, we actually summited Mount Kenya. I, with all my personal stigma, personal inhibitions, personal beliefs, I was able to summit to the top. And I did not go alone. We went with 10 cancer survivors, 1 person living with chronic arthritis, and with 3 other crew members who are accompanying us. But that's not who we really reached. The people we reached with the stories on social media about climbing up Mount Kenya, the people we've reached because ever since, every single month, at least one of our survivors is featured in media and also on our social media to be able to enlighten others about survivorship, to enlighten others about ownership for personal health, to inspire others to start taking active, deliberate exercise as a way to improve their livelihoods, and also to inspire others to question their decisions, be it about diet, be it about personal goals and goal setting, be it about fitness, also be it about financial management. We proved that it can be done if you set your mind to it. But ultimately, it also started highlighting on an international platform the risks that we face with survivorship. Our healthcare system is made in such a way that it treats diseases. Our healthcare system does not cater for prevention, in the sense that we are all born healthy. Our job is to maintain that health. But if a disease should come, when someone is treated and they've recovered, the next steps is how do they survive? What is their quality of life? And that's what we are addressing as a community, that we are saying there is life beyond a cancer diagnosis, there is life beyond diabetes, there is life beyond any non-communicable disease, and the chronic illness is not the defining factor for your health. It's about you taking charge for yourself. So really, speaking much, but also saying that the ultimate achievement for us, besides climbing up Mount Kenya with cancer survivors, many people said it can't be done. It's about what else we are aspiring to, that each person looks at internal mountains, be it stigma, be it mental health, be it physical fitness and weight loss goals or weight gain goals, be it whatever your personal challenge, that you can take it up and do it because it is doable. We can live beyond. Climbing Mount Kenya. Initially, as I mentioned, I was doing it as a personal achievement. I was doing it for me to get out of the depression, to reignite my hope in advocacy, to rechannel my energies towards survivorship. And so I did it as an individual, but taking on others to walk far with them. When we came down the mountain, they told me, you cannot stop. You cannot stop doing this, because we've seen some of the impact being in their own personal reported outcomes, that some of them reached their personal weight loss goals. Some of them with a cancer diagnosis comes insomnia and comes anxiety and comes fear of a recurrence. They started being more confident about themselves. It also started with advocacy for survivorship, that now they are sitting on various panels, that they are approaching the media to cover their stories, to educate others. When they said you cannot stop, what that did for me is we actually sought to register as an association, because then we want to do it in a proper manner, to do it with structures and systems in place. That was one of the greatest impacts from that climb up the mountain. The other one was the realization that yes, COVID is here and it's going to be with us until the vaccine is here, and even after vaccination, people need to take charge of their health. And so we have been deliberate about our programming, that it's touching on ensuring people own their own health. So the constituents that we are reaching, the membership that we are reaching, and even the general public, is to educate and sensitize, that they understand, despite COVID, you can still achieve your goals and attain your own personal challenges that you set on yourself. And lastly, I think COVID-19 taught me something. And it comes from when I sat and watched Ineos, Eliud Kipchoge, do the Ineos. That's the day that I decided I'm climbing Mount Kenya, when I watched him do the marathon and do it in under 2 hours. And what COVID has taught us as well, besides the being unlimited, is that you can achieve anything you set your mind to. Who would have thought cancer survivors can go up to Lenana, the point? Who would have thought that with all the limitations of financing and all the limitations of getting people who can actually believe in the dream in the year that all corporates were cutting funding, that we can be able to reach that summit? And who would have thought we would brave snow? I can tell you, we have snow in Kenya, and it is not an interesting journey. But guess what? We overcame it. All that for me, in spite of COVID and despite the COVID pandemic, we were able to achieve. And that for me is inspiration to say, whatever you set your mind to, you can live beyond limits. We have big dreams and big vision. Our vision is a Kenya where we have members as well as the general community living wholesome towards purposeful living, deliberate choices in health. We also look at Kenya where the survivors are empowered to tell their own stories, so that it's not me sitting behind the camera telling the story of the survivors. It's they themselves who are inspiring hope in the other people to realize, yes, it's a journey, yes, you can do this, and yes, if you take your mind to it, you can inspire others to either preserve their health or to prevent diseases, or even to overcome diseases and challenges to live wholesomely. But more importantly is that there is a lot of gaps in research on survivorship. Why is it today in Kenya, if you're diagnosed with breast cancer, you have a 43% or so chance of surviving for 5 years? Whereas if you're diagnosed in the US, for example, you have a 78% survival rate for 5 years. Why is it that in Kenya, if you're diagnosed with cervical cancer, you have a 33% survival rate for 5 years? Whereas if you're diagnosed in the US, you even have an 80% survival rate. Why do we have better quality of care in the US or in the UK or in countries that have taken their advocacy high compared to low and middle income countries such as Kenya and the rest of Africa? Why is it that we have policies that don't provide for people living with chronic conditions, for example, survivorship in diabetes or survivorship in even cancer, for example, yet we have provision for people who are living in old age. Why would somebody not also get support from the government with NHIF to cover the full treatment journey? So these are things that we want to cover in research so that we inform policies that are grounded in knowledge. The second thing is community education, because I mentioned majority of us are born healthy. And if we work towards maintaining that health by addressing the risk factors that are modifiable, weight and obesity, for example, if we address alcohol consumption, smoking and tobacco use, if we address our environment as a source of disease, we'll be better able to maintain health as opposed to losing health and then trying to recover it. And for the people who already have the disease, because we cannot prevent everything. For the ones who do, if we lessen the burden on the healthcare system, it will be better able to handle the healthcare system needs. And so for us, it's to ensure that we are deliberate in our programming for community education so that people own their health. And when they do, it will be better able to, even for government to manage policies and even for the communities to manage their health. Thirdly, we see ourselves as setting up trust funds. I've come across in my 9 years of advocacy in health, I've come across women who lose their husbands because they've been diagnosed with cancer. I've come across women who lose their life because the cancer was diagnosed so late in the hour. And the people who suffer are the children. They didn't ask for this. So if we can set up trust funds or mechanisms to provide for these children so that they have a better chance at education, better chance at health, it will mean in future that we are addressing health disparities in Africa, reducing the risks, reducing the challenges, and making it possible to have universal health for everyone. And lastly, it's to empower people living with chronic conditions, that they become their own advocates. They have the self-agency to tell their stories for impact. And when this happens, we will demystify the diseases. Just like HIV and AIDS was able to demystify, and today people say it's better for me to get HIV and AIDS than to get cancer, we want to get to that point where people are saying, I know if I'm diagnosed with cancer, I will recover. I know there are some cancers I can prevent, like for example, giving my daughter HPV vaccination prevents cervical cancer. We want people to own their health. And that can only come from demystifying the diseases and equipping people with health messaging that brings them to the point where they're taking health in their own hands and living beyond expectation for us to have a healthier nation. Why do I think I deserve? I'll tell you, I've watched Zuri for a number of years and I was always afraid to apply because I kept thinking everyone else was so much more deserving. But this year, I've chosen to apply not for myself, but because I know what this will do for the organization and the people I'm serving. This is part of my inspiration journey to show others that if you set your mind to it, you can achieve it. Zuri for me means a network of other people who are achieving amazing things that we can plug into to be able to bring the story to the communities. Zuri for me means being able to access platforms where we would otherwise not be able to. And by bringing the survivors to the conversation, by bringing everybody that I'm working on to the conversation, we'll be better able to amplify the voice for advocacy. Being a Zuri advocate or being a Zuri alumni also means that the work that we're doing will get on a different platform. And we are all about innovation. People are always thinking for health, you need to go to a hospital. What about at our community level? What about at these awards? I have won other awards in the past, and some of them I was nominated, and some of them they called me up because of the work that I've done. But this one I deliberately applied myself, because I want to show my constituents, I want to show the survivors we're working with, I want to show the caregivers that no action is too small. And if we do this and we get the award, then we will utilize it to amplify the voice. So I'm hopeful that I'll join the alumni, and if I'm not, this is already a win for me, for the people that I'm working on, because I guess they will get to see this video and they will see what it is that we're trying to achieve. Kilele Health Association has the Kilele Challenge. And the Kilele Challenge is an annual challenge where we're taking survivors up the mountain. We're challenging perception that cancer survivors are on a deathbed, they're going to die. People living with chronic arthritis should not go to cold places because they will be frozen to death or their limbs won't move. People living with diabetes cannot do so much more. People living with asthma cannot do strenuous exercise because they will not be able to handle their lungs. I have had someone who had anal cancer where they got radiation on the back side, lower back area. And when radiation is applied, it freezes, it's sort of, how do you say? It hardens the muscle, hardens the sinew, hardens the whole infrastructure for the body. And she climbed up to Mount Kenya. We're challenging perceptions that you can't do that which you have set to because society expects you not to, or society expects it's too hard for you. And Kilele Challenge is about challenging perceptions. Kilele Challenge is also about challenging policy, so that we're providing policies for long-term empowerment and long-term achievement for health. And so for us, we look at our programming and we look at our at our work as inspiration for others to start challenging themselves. What is it that you set out and you said, I will do, but you've not done because society has told you you can't do? What's stopping you? Because the biggest limitation is yourself. What have you set to do, be it in business, be it in social change, be it in your personal life, be it even in your marriage and raising your children? What is it that you are limiting yourself from doing? The biggest mountains we have to climb are within ourselves, and that's why Kilele Challenge. The outward show of what you achieve will also be a journey and a path to inspire others. So get up and do it. Don't stop. For International Women's Day, it's actually challenging women and men and young boys and girls to relook at their life goals and be deliberate about their actions. That every single day should matter. That for you to achieve 360-degree change in your life is not going to be waking up and choosing to shoot for the 360. It's about doing one every single day, just 1%. And before you know it, by the end of the year, you'll have done 360 degrees of change from where you started from. That's challenging for women and girls and men and women. For the SDGs, the UN SDG number 3 is about good health and well-being. And I have had many organizations interpret this. But I keep saying for us as an organization, it's not just about the SDG number 3, where we are addressing good health and the well-being. Yes, we're doing this in 4 pillars, which are usually used to evaluate good quality of life in survivorship for chronic illnesses. And this is physical fitness, this is mental wellness, this is spiritual or purposeful living, and this is also financial wellness to reduce the toxicity that comes with health disparities and that comes with people handling chronic illnesses, which can sometimes lead people to impoverishment. And if you look at that, then we are also addressing other SDGs, because in terms of impoverishment, we're also addressing SDG number 1, no poverty. SDG number 4, health literacy and education. We're also talking about number 8, decent living. For survivors who have had to sell their land, what income generating activities can they get into so that they start earning an income? SDG number 17, about partnerships and collaborations. We are doing our own little thing. What about the other alumni in the ZuriAwards, for example, who could be doing an economic empowerment or who could be doing business and they're looking for CSRs to work with? All this for us is about partnership, each person doing their best to be better able to have an impact across board. And without forgetting climate action, people don't know that some of the toxins, for example, smoke, be it secondary smoke from smoking and tobacco use, or even asbestos in roofing. Some of the houses in Nairobi have asbestos. That's a carcinogen. It causes cancer. And people don't know this. So educating them to own their health is to understand what toxins exist in the environment, what toxins are we consuming in terms of, for example, all these things that are used to remove dudus from the plants and they're not washed nicely, and then somebody consumes that, and over time it accumulates in the body and causes cancer or causes other lifelong diseases. Taking ownership of health, the UN SDG health and well-being cannot be taken alone. All these others that I've listed are things that we are addressing so that we are able to guarantee or at least inspire people to have health and well-being at all ages across their life continuum.